So we've heard from Catalonia. Next, we're going to be heading to France. And I'm just going to say a few words about France because people may not know what's actually happening there. And while I know Isabella and Julien are going to be talking about the wider space, I've become increasingly interested in the diagnostics and the new models of care that they're actually deploying, which Julien is actually involved with. So for me, again, France is a very interesting nation. And I'm going to let Julien and Isabel, who is the International Director and eHealth Europe member, tell us a little bit more about their progress and what's happened during COVID.
Welcome to this session, very interesting session today around the Global Health Connector partnership with the ECH Alliance in partnership with Health and HATA. We are very pleased today to have a session to give a tangible example of the cooperation we can have at the international level, especially with Europe and with France. We will have a full session today about what is happening in France and what is happening in Europe. And I have the pleasure to welcome Isabelle Zablit, who is eHealth Europe and International Director at the Ministry of Health in France, who will explain us today what is happening in terms of digital health strategy and digital health actions in the French health system, but as well at the European level, because France has a special role in this first semester of 2022 in Europe, because France ensures the presidency of the Council of Europe. So thank you very much, Isabelle, to accept our invitation, and welcome.
Thank you very much, Julien. I feel very much honored to participate to this exciting event and to share with you the state of play in France and in Europe.
Thank you very much. I suggest you start right now. You have a few slides to explain to us because it was easier to understand with a few pictures and examples to illustrate the strategy in France. And then we will have a few minutes to have some questions and discussion. The floor is yours.
Thank you so much. Yes, indeed, I think it will be easier to have some slides to share with you the state of play. So do you see my screen?
Perfect.
Okay, let us start then. Well, really happy to share with you where we are, where we go, and how we do what we are doing right now. So I'm really happy to establish those bridges between Paris and Miami today. And start with, I suggest to start with explaining to you what is the journey of digital health in France right now, and what was the starting point, and where do we go? Well, just to give you a brief introduction about the context and the landscape of e-health in France, we have the responsibility of the Ministry of Health to drive the agenda of digital health, but we also collaborate very closely with our National Digital Health Agency called ANS, Agence du Numérique en Santé. The entire healthcare system is being financed by the social insurance CNAM. This is a national system. And we have also an actor, a player, which is well recognized at international level, which is the Health Data Hub. And the Health Data Hub is in charge of the reuse of health data in France. So we have a population of 69 million inhabitants, more than 3,000 hospitals, and about half of them are private sector hospitals. So we have a system which is organized both with private and public sector. And we have also a very high amount of institutions in social care, more than 35,000. And this is also extremely important because, as in other countries, this is a sector, a fringe of the sector which is under digitalized currently. Also, in France, we have several success stories in terms of startups in ES, and I recognize innovation ecosystem, and this is a strong pillar for our strategy too. So it all started 3 years ago with the vision of Dominique and Laura Letourneau, who are the co-heads of our Department for Digital Health at the Ministry of Health. And they had this vision that they represent as a house of having the state in the driving seat, I would say, of the roadmap, but in an extremely close collaboration with all parties, all stakeholders from the ecosystem. And what does it mean, this vision of a house? How can you represent this? It's very, this image is I think, quite self-speaking. Whenever you build a house in a city, you need roads, you need electricity coming to the house, you need water coming to the house, and several things like that. So that means that even so, you have the ability and the freedom to design your house, you need to rely on several services, core services that are put in place by the state. And those services are provided on the basis of several technical referential systems. So that means that if everything wants to be smooth, everyone has a role to play in the system, and those roles are extremely complementary in essence. And it's the same for digital health. We need to have some core referentials, we need to have some core services, and we need to have several layers of services for professionals, for citizens, and we need also to think about the use of data for larger, in a larger scope, with industry, with the researchers, for public policy making, for instance. So this is what we describe as the vision of the state as a platform, where the state is basically acting as a platform by providing those core referentials, by providing some core services. And by the way, some of the core services can also be delivered with the help of and the support of the ecosystem. And we need to have this being put in place in the right way. So part of the court referentials, without any surprise, you will find the fact that you have interoperability in place, that you have security in place, but also that you have ethics in place. And this is also a strong belief that is driving the agenda. So it's not about, it's not about an ID or isolated from the rest of the world. It's a full vision, a full-blown vision about what is the role of the state and how are we going to provide the right urbanization process of the entire ecosystem. So, and the scope is again not limited to health, but also ensures that social care is part of it. So that was a starting point 3 years ago, and now we are in the middle, I would say, of the implementation. We started from far because there was a lack of digitalization of the healthcare system in France, and this roadmap has been translated in a calendar at high speed, I would say. It started in 2019, and on the basis also of a technical doctrine, again, to ensure that we have the right referentials in place. In 2020, we started a lot of initiatives related to ethics, and especially with the start of the Ethical Council. In 2021, it has been branded as the Year of the Citizen because we were on the way to launch, and that occurred a couple of weeks ago, My Health Space, Mon Espace Santé, which is the direct link between the citizen and the citizens' health records. on the way, we had the good news to receive a lot of incentives also from a national standpoint with due to the pandemics, you know, that there is a recovery and resilience plan at European level that is translated at national level, and digital health has been recognized as a top priority part of this agenda. So this is also extremely instrumental to help us drive at high speed our roadmap. So we have been starting not only with the technical doctrine, but also by a full reshaping of the governance of e-health in France, because the vision is to work extremely closely with the entire ecosystem. That means that we have several committees in place where we have a direct link, and we can, I would say, challenge our ideas and the roadmap with the various stakeholders of from the ecosystem. So we have the patient association, we have the health professionals representative, we have what we name the structures, so the various bodies that you can find in the healthcare system. We have both private and public sector represented. We have also the layers of the regions and the local authorities. So every single stakeholders is part of that, and I see that's missing on the slide. By the way, we have also, of course, the the industrial companies, and so the software providers, but not only, that are part of this collaborative work. We have a new team, a brand new team in place. We have the youngest directorate of the Ministry of Health. We did create, as I said, the Ethics Council, but also the National e-health Council, where we report twice a year the progress against the roadmap. And we have also implemented a full transformation of the National e-health Agency. So it has been a tremendous work, and now you can see some of the concrete results already taking place in the reality of the French citizen. Just a few more words about the Recovery and Resilience Plan, which is named the Ségur de la Santé in France. It is organized against, in fact, the main, I would say, the main areas of healthcare. So you have a stream around the social care, a stream around the hospital, laboratory, imaging, and liberal doctors. So all of them converge to have a full interoperability and I would say smooth transfer of health data, what until now did not occur at national level. So it means that whenever you are out of an appointment with a liberal doctor that sends you to the hospital, it means that the same document that you receive will be received instantly by the hospital in a digital way. So this vision and was also obliging all the teams to work in parallel and according to the same standards and to deliver the same results at the same time. We've been out of the wave 1 last summer. Next summer, we have the wave 2, which is expected. And that means also that we are financing the software providers to review and to implement in their softwares all necessary evolutions at very high speed. And at the same time, we have some incentive to have the use case in places at the same time. So it's a strong investment, but it allows us to change, I would say, the picture for every citizen at the same time, but also for the health professionals, because it's going to facilitate to provide them a lot of comfort in their practice. At the same time, the same recognition of digital health being a top priority was made by the European Commission. It was also made, by the way, by G7, for instance. So we see that at different layers in the entire international ecosystem, it resonates the same way, and we need to synchronize, and this is a main challenge, we need to synchronize what we are doing at national level and international level. So to be extremely concrete, I said that My Health Space was launched in January 2022. So Mon Espace Santé, that means that the citizens right now have a direct link to their health data. And what we are doing with the recovery and resilience plan is to ensure that Mon Espace Santé is being populated by all parties in the ecosystem, by forcing the digitalization at all levels. Mon Espace Santé goes beyond that because it also includes a secure messaging system, allowing for a secure communication process between health professionals and citizens. It also includes an agenda and an application with several applications, more than 30 to start with, that they've been selected, of course, against their purpose, but also against their compliance to the ethical, security, and interoperability frameworks. So this is very important to have that in mind. Mon Espace Santé is not only a repository, it's much more than that. Part of the roadmap, we have also several initiatives. It's not something that we do alone in our office again. We work very closely with all those committees I show you, but also we go to the citizen, meaning we do a Tour de France. As if you like cycling, you know the Tour de France, but we do the same. We go to every city to meet the citizen, to meet the local ecosystem, and to ensure that what we are doing is aligned with their expectation. We also have an initiative called Genius that does exist now in English to embark the entire innovation ecosystem and also ensure that entrepreneurs have a speed, a fast access and use more speed in a smart way to go to the solutions that they require to put in place their proposal for the ecosystem. So Genius is a kind of hub for innovation and also helps to facilitate the entire innovation process. So as I said, this is a national extremely strong drive, initiative, effort, and it involves all parties and a lot of financing. But it's also part of a larger journey, which is currently also in place in Europe, and this is also important to bear in mind. You may remember that Europe is I would say, something quite exotic in a sense, because we have countries that have their own legislation, but also rely on a European layer of coordination, and this is very important to have in mind when related to health. In fact, health is not a topic that is a European topic; it's a national topic. It's a national responsibility. However, we need and we do require this layer of coordination. What does it mean in practice? If I'm traveling to another European country, as a European citizen, I do expect to receive the same level of quality of care wherever I am in Europe. I believe I deserve this, and this is something that all European citizens do expect from their authorities. So having said that, you understand, you can grasp the difficulty to have this layer of coordination despite a different landscape of organization, of financing system, and of processes. Of course, it means that we need interoperability, and we need also to prioritize what we are doing at European level. So the main vision is to develop a European health data space, and this is very important. This is already a working process, I would say, a journey, and we'll have the coordination expressed in a regulation that is expected during the French presidency of the Council of the European Union. It means this semester. So this is something really a part of our main targets and main milestones in the coming months. What as Europe we have been preparing in view of this regulation? We have two parts. We have the first one, which is devoted to the patient care, and the second part, which is about the use of health data. For the first one, Europe has been implementing a secure infrastructure to allow for the exchange of health data in a secured way and with the consent of the European citizen. That means that if I'm getting sick in another country, I can allow the health professional in the other country to access my health data. This is the vision. We have already some part of it being put in place. We started with the patient summary exchange and the e-prescription together with the e-dispensation. The next documents that will be exchanged through this secured infrastructure are the lab results, the imaging reports and images, the hospital discharges, but also the rare disease part and the original clinical documents. So that means that there is an implementation plan in place. We have already 9 countries on board, and we target to have the 27 European countries being onboarded by 2025, and also the use cases that are currently limited to patient summary and e-prescription extended to the other documents by the end of 2025. In France, we are happy to have our initial use case being licensed last summer, and it means that every health professional in France can already access the patient summary of patients living in other countries, and in this case, it's Portugal, Croatia, Malta, Czech Republic. The very important comfort zone for the health professional is that you know that we have various languages in Europe, and not everyone understands all languages, of course. So all what we are doing is being translated in all European language. That means that the health professional has the comfort to access to the patient data, both in their original document, but also in a translated version in his own language. So this is providing a new dimension and providing the quality of care for the European citizen. Regarding the secondary use of data, this is also an ongoing process. It's a couple of years, and it has been always a top priority of the European Union to ensure that we have the right level of the reuse of health data to offer to the entire ecosystem. And with several steps, several initiatives that have been put in place over time, and that are now part of the reality, because we have first a joint action, which is an instrument that is put in place by Europe to allow for the coordination between countries. So we have already 25 countries working on that joint action, which is in fact paving the way, preparing the ground for the European health data space in terms of the use of data. So a lot of this preparation work takes part within that joint action, and France is part of it. A second step will be starting soon with a pilot of the European health data space, and also France has been also raising its hand to be part of that, and we have assembled a consortium to propose a pilot for the European health data space. So this is two different initiatives, but both of them are preparing the global vision of the reuse of data at European level. So we are, as I said, we are now in a 6 months time frame where we have to help the Commission and the member states to move forward with that. And this is something that we do with a lot of enthusiasm and energy. We have the French president, who has launched this 6 months period by saying that he wants to raise the ambition of Europe of 3 main principles. First, the fact that we need to relaunch the European economy to make it strengthful and to base the ambition on European belonging, sense of belonging. So these 3 principles resonate for digital health, and we have articulated a strategy around that. And I'm sure that Julian, you will have some questions around it. So thank you so much.
Thank you very much. Thank you very much, Isabelle. Thank you for this very comprehensive presentation. Very important messages around the French strategy and the European strategy, and the fact as well that we can say to our colleagues in North America that they are welcome as well to participate, because you mentioned the Genius platform, for instance, at the French level, which is now open to international players to come and participate to this strategy. So I think we can address an invitation to all the attendees of this session to come to France and to participate to this digital health movement initiated in France. Maybe we are already over time, but I think it would be interesting, Isabelle, if you could tell us a bit more about your work with this role of presidency of the European Council, and you mentioned already the key projects and the key initiatives at the moment with the European Health Data Space and the different regulation and legislation that will be developed in the next months, next weeks, next months, very, very soon. What were the key priorities in terms of digital health for France to push on the European agenda for the next 6 months? And what are the key topics you're working on at the moment?
Well, basically, what we target globally and not in healthcare only is to have an approach of digital single market in Europe, because otherwise we are too many fragmented countries. So this is valid for every sector, and this is valid for digital health also. You know better than I that it's very important for all parties to have this scale, in fact, this scalability. So and it's also for the sake of the citizen and the health professional, as I described a little bit earlier. So 6 months, this is very quick, and we want it to be quite helpful. We also know that implementation of digital health can face some barriers, some blocking elements, and this was basically the burning platform to assemble a strategy for those 6 months. So we have several initiatives that we have proposed to the other member states. The first of one was to tackle the ethical framework in which we can work in Europe. And the pandemics has put some light on the fact that it was a prerequisite and it was essential. And we believe that it's very, very essential to move towards the European Health Data Space. You remember that I shared the first slides, the fact that it was part of our core referentials to have this ethical framework. This is valid at national level, and that is valid at the European level, and this is valid also, by the way, at the international level. This is very
including North America.
Yes, this is very much a strong belief that we have, because in case you do not tackle this, it comes back as a boomerang. Sure. And the risk that you take is that you do not have the right uses of digital health. So we wanted to really have an open discussion with that, and we had a fast track approach to validate, to adopt the ethical framework in Europe for digital health. That was done in January this year, and we will work on that on the later in the coming. We are working on that, by the way, and we are preparing the implementation plan, the communication plan, the governance, and all the necessary information that all countries expect to be in a position to communicate directly towards the citizen as soon as possible about the progress that they've been made. Because those ethical frameworks are simple but are ambitious, because no country is fully compliant with all of them. So this is a tremendous effort and a collaborative approach, because we all know and we all recognize that we need to progress against those principles. So this is a very much a teamwork and a collaborative journey.
It's a very European touch to focus the work on this first basic element.
Yeah. This is a European initiative in part of the French presidency of the Council of the European Union, but it's also valid at international, I have to say. So we have also other initiatives. For instance, we support the drive that has been put by the European Commission to share an interoperable framework. And that means that we need also to agree on several standards. So you may have seen that the European Commission has invited all countries to be implementing Stormed City. So this is also something new for France, but we are starting also to put this in place in order to move forward towards the European health data space. Another area where we have an initiative is the market access for digital for medical device, where we believe that we should have a better coordination and even an harmonization of the levels of the clinical trials steps. So that means that if we can agree on that, it will that will facilitate and speed up the process for all entrepreneurs in medical devices. So those are some of the key elements, and there will be more over time, but always with this idea of having a digital single market for health.
Sure, and the maturity of digital health, and we've seen that a few days ago with colleagues from France as well at the Mobile World Congress in Barcelona, and we discussed about this maturity of this market, the digital health market, which was a few years ago a market of innovation and project and pilots, etc., and now is a reality for most of the markets and the countries. So very important to work on this market access, and very key question for a number of companies, startups, or large companies as well.
However, I would say I'm not very keen about using the word maturity, because we believe that we are in a virtuous circle of progress, and I mean we will never be mature. If I want to take some part of philosophy here, we will never be mature, because technology will always be ahead of us.
Sure, you're right. Thank you very much, Isabelle. We are running, unfortunately, out of time, but I thank you very, very much to have been here today to present us what is happening in France and what is happening in Europe. It was, I believe, very important information for our audience today, especially for out of Europe players who are attending today, and to understand a bit this difficult environment, which is Europe for people coming from outside Europe. So it's not an easy market for sure, but it's an interesting area for American players and other from other countries in the world. Thank you very much again, Isabelle, and give the floor to the next session. Thank you very much. Have a good day.
Thank you. It was my pleasure. Thank you very much, Julien, for the invitation.
Bye-bye.
Bye-bye.
Wonderful. So we've completed our world tour now. We've had Africa, India, we've had bits of Europe, and we're coming towards the close.